Hi there, I'm Janelle Marie. Welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of different procedures. We've got eyelid lifts today, face lifts, tummy tucks, fat grafting, and whatever else we want to talk about.
All right.
All right. Before we get started, remember, any advice we give you today, consult your own physician first. All right, let's jump right in. Let's talk about eyelid lifts, doctor.
Okay.
So how does an eyelid get lifted?
Well, there's two things that go on with the eyelids. One is they get extra skin on them.
Yeah.
And the other is the fat that pads the eyeball comes forward.
So that can happen on the uppers only, or upper
uppers
and lower?
and lowers. On the uppers, interestingly, usually it's just in the inner part, like right close to the nose. But on the lower eyelid, we've all seen people with big bags under their eyes.
Yeah.
There are 3 compartments of fat there, and all of them can come forward and really fill that area.
So it's just age that makes the fat come forward?
It's age, and what's funny is it's probably also loss of fat. Because we have fat on our cheek usually, and as we get older we lose some of that fat and we get to see what's underneath, and sometimes there's a little, like a pseudo hernia of fat underneath.
Oh, that's awful.
No, it's
you
easy
can
to
take
fix.
It out, though. Okay, good.
So the upper and lower eyelids are like 2 different operations.
Yeah.
The upper eyelid, mostly we're focused on getting rid of extra skin, the hooding, what makes people look tired and sleepy.
Yeah, absolutely.
And the lower eyelids is more trying to get rid of that fat bagging.
Because a lot of people can be born with heavier upper eyelids, like Renee Zellweger and things like that. They're saying she had the plastic surgery and all that. So it's, you know, a little controversial because it looks good on some people, but then you might have to take it off. How do you know?
Well, I think if you're used to seeing someone a certain way and now it's dramatically different, it's very noticeable.
Absolutely.
So my goal is to change things, make people look more awake, but still look like themselves.
That's fantastic.
And I think with men it's even more important, because if you take away too much skin on the upper eyelid or elevate the brow on the upper eyelid, low brows are masculine. I mean, George Clooney's a good-looking guy. I think most people would agree.
Yeah.
His eyebrows are almost in his eyes.
Yeah, you're right.
And it looks good.
You're right.
Because he's a man. But a woman who has eyebrows in her eyes looks masculine. Not as happy with that.
That's a good point, because you don't want to do that. Okay, so then where are the scars when you do uppers and lowers?
So the incision, there's a couple ways. Incision for the upper eyelid mostly is in the fold, so when the eye is open, it would be in that crease.
Okay.
And then we'll extend it to the side a little bit to get rid of any extra sort of blinder, extra skin on the side. For the lower eyelids, mostly the same thing. We go right underneath the eyelashes so we can hide it. But if it's a younger patient who just has fullness and the skin is still very tight, then we can go inside the eyelid and completely hide the scar.
All right, so when you do that, does the patient go to sleep? How do
Don't have to.
Oh, really?
Certainly anyone who wants to go to sleep goes to sleep.
Yeah.
That's easy to arrange. We have anesthesiologists that will make my patients comfortable.
Yeah.
So usually the first question I get from patients who go to sleep is, when are we going to start? You know,
oh, really?
After we're
already done?
Yeah, they don't. It's just that quick. But a lot of times we'll do it under local, and there are advantages to local also. If someone's not real anxious about it, doing it under local tends to give you less of a hangover, sort of less of that tired feeling. There's no nausea with local anesthesia, which we can get sometimes with general. And for people who have ptosis, or a little bit of sagging unevenness of the upper eyelids, being awake helps me, because they can open and close their eyes and I can see what their eyelids are doing.
Oh.
Because it's not a static structure.
Oh, okay.
Sort of
so it's a little easier for you.
Yeah, we want to see how it moves.
So what about the recovery time then?
Recovery time, mostly it's how you look rather than how you feel.
Really?
So you'll look like you got beat up, but you'll feel good.
So you'll get the bruising, and you'll get the maybe black eye look and all that. Okay.
It's a lot like a black eye.
Oh, okay.
It's the same as, you know, when we get hit in the side of the head, we get a black eye.
Yeah.
There's bruising probably everywhere, but we just see it underneath the eye because the skin is so thin.
Okay.
So any small amount of bleeding into the skin shows up on the eyelids.
Okay.
But the recovery, most people are comfortable. Usually Tylenol is enough pain medication. Ice works really well.
When can you go outside and you know, go back to your coffee place or whatever?
Depends on how much explaining you want to do.
Oh, okay.
I had a patient, I saw him on TV the day after we did his procedure, which is not recommended.
No, that's not.
But he was happy with that, so it was
Lots of makeup.
Yeah, dark glasses.
All right, so you mentioned brow lift. So I would assume, you know, we're talking about face. So brow lift might come in. So how does a brow lift work? Because that seems like it's tough. Do you have to get it under the hairline? How do you do that?
Again, there's different ways to do brow lifts.
Okay.
And whenever I'm doing eyelid surgery, I always want to look at the brow. Because if the brow is low, it's something that should be talked about before doing the eyelids. It doesn't mean it has to be done. Right. But sometimes if we do eyelid surgery and remove a lot of the extra skin, it takes away the option of lifting the brow up. Right. Because the eyelid then is open.
Right.
The most common ways to do brow lift are either open or endoscopic. So endoscopic means making little holes, basically putting like a telescope in there so we can see what we're doing, and elevating the skin, detaching the skin so that it'll come up. And there's a pair of muscles called the frontalis muscles that help to raise our eyebrows. So when we're like doing this, that's what that muscle does. So if you release the attachments just below the eyebrow, that muscle will tend to bring it up naturally.
Oh, it will.
And it looks, I think, very good that way.
So your eyebrows go up a little bit.
We want the outer part of the eyebrow to come up usually.
Oh.
The inner part comes up, we look worried or concerned or goosed, and I don't want people to look surprised all the time.
So you'll still have full functioning of your eyebrows?
Yes, so the eyebrows still move.
Okay.
And then the other technique is an open technique.
What's that?
Which is where we make an incision. If we're doing a facelift, we just carry that incision up on the top so that we can remove a little strip of scalp that actually brings it up, and that can give us even better results for people who are really tonic or have really deep lines. I think the open approach still works better.
You know, can you ever do an over brow lift? Because I know Marie Osmond came out and apparently she had, does it settle though? Does it take time to settle? Because is that just always the way you look in the beginning and then it settles down? Because you can have that surprise look.
Yes. No, and I think the face itself is more forgiving because that skin tends to move more and stretch more. The brow lift, you have to be really careful. Because if you overdo it, it will take a long time to settle down.
Oh, wow.
And sometimes it just stays high.
Does it really? Oh, see, that would not be good.
No, that's why you want to see an expert. You want to talk about the results that you want and go over, you know, what to expect afterwards.
Okay. And then, since the skin is very thin underneath when you get your unders done, can you fill that? I mean, does it take all the fat? Does the fat ever come back? I mean, how does that work? Because will you have more drooping fat in there?
Yeah, fat doesn't tend to come back.
Oh, that's good.
It causes a different problem, though, is if I take out too much fat, it will skeletonize the eye.
Oh, yeah.
And then people look older.
Yeah.
And if you look at someone who's 90 years old, that fat eventually does go away.
Yeah.
So I don't want to accelerate the process.
Okay.
So I want to leave enough fat that it stays smooth.
How do you do that?
And sometimes we move it. You know, sometimes there's like a dark crease down in this area where the bone attaches.
Yeah.
And we'll take the fat and actually put it down in that area to push it out and help to make it smooth. Because a short eyelid is actually a youthful eyelid.
I'm glad you're doing that, not me. All right. All right. For more information about Dr. Mealy, you can call 925-943-6353 or check them out on the web at either drmealy.com or sanfranciscobreast.com. And I want to tell our viewers that you can see before and after pictures on drmealy.com of all the procedures we're talking about today, right?
Yes, absolutely.
All right. When we get back, we're going to talk about more on plastic surgery. Stay tuned to Body Beautiful. We'll be right back.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.